This image depicts the anatomy, beginning with the base of the head, leading into the throat and to the beginning of the chest. Beginning with the vagus nerve, branching off of that is the superior laryngeal nerve, leading into the larynx, followed by the left recurrent laryngeal nerve, which branches to the trachea, to the esophagus, and down to the aortic arch. This shows the root of the left recurrent laryngeal nerve and its proximity to the aorta. Voice and throat. Particularly if you've had surgery, you may have trouble speaking, or the quality of your voice may not be what it was before. There are two main causes of this. During surgery, you probably had a tube down your throat to help you breathe. This is known as intubation. You may remember this tube coming out, or you may not. Voice complications are not uncommon after intubation, especially for long periods. They can include sore throat, hoarseness of the voice, and difficulty swallowing. These are usually minor complications and usually resolve shortly after it is removed. If your dissection involved the aortic arch and/or you had extensive open heart surgery, one of the nerves that controls your vocal cords may have been affected. The nerves that controls your left vocal cord loops under the aortic arch and must be carefully identified and sometimes moved by your surgeon when they repair your aorta. This nerve is called the left recurrent laryngeal nerve, LRLN, see diagram opposite. If this nerve is bruised or injured, it can prevent the left vocal cord from closing correctly. You may find that you are hoarse, unable to speak in anything but a whisper, or you may find it very tiring, forcing air over the vocal cords to try and make a sound. You may also have trouble swallowing while eating and drinking. In most cases, such a nerve injury will resolve on its own in typically 3 to 6 months. Humming your favorite songs, other vocal exercises, and speech therapy can help. In some cases, it is necessary after 6 months to see an ear, nose, and throat specialist to see if your vocal cords have started to move correctly. If not, you might have a small surgical procedure to reposition the vocal cord and restore your voice. Your PCP can make the necessary referrals.